All. This is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. Today we have a very important topic to discuss, and this topic was sent to me by one of our cool beans from South Africa, I believe from Africa. He himself had gotten COVID as well, and then he has recovered. We have talked about him in the past as well. So it was nice of him that he sent us this article. I think it is really important to look at it. The topic is how dust and pollution causes the vitamin D to become less effective. And then how does that cause harm in case of COVID-19 and actually with other pathogens as well. We have done detailed discussions about the mechanism of action of vitamin D. We have discussed various studies for vitamin D. We have discussed studies with the levels, the right levels of vitamin D. All of those are present in the previous talks. Today, I want to specifically focus on the role of dust and pollution in reducing the effectivity of vitamin D. So that is the basic topic today. Let us start our discussion. A couple of things. Number one, I have started two GoFundMes. One is for the COVID-19 handbook. So thank you very much. The folks have started contributing, and I would request that you do that too as well. If I can get some decent funds, we will write a book. The second is for Nina. So this is the GoFundMe for buying Nina health insurance. My request to you is, I have tweeted this link out. My request to you is that even if you do not, let's copy the link, and I'm going to put that link out there in the chat as well. So even if you do not contribute towards the book, please do me a favor. I have just put the link out for Nina. It is $2,400 for the whole year. It's not a lot of money. I need your help to raise that. I will be really sad if I cannot even raise $2,400 for someone's health insurance for a year. So if you can pitch in anything, please do me a favor and do that. So with this, let's start our discussion. This is the paper that we will discuss. The link is in the description. Let's start with our illustrations. I think you like some of the illustrations today as well. So first of all, an update on the cool beans. John's father is still in the ICU. He is struggling with the health of his kidneys. His lungs have actually become better. Doctors are not much concerned about his lungs or COVID. The current challenge is that his liver and kidney are not functioning as good as they should be. So they are trying to do their best to recover those tissues. So please do me a favor. Please pray for his father and for him. And I hope he recovers fully and soon. Now, on the vitamin D side, we already know that vitamin D is very commonly deficient in people, correct? We know that it is deficient in old age. We know it is deficient in pigmented skin folks. We know it is deficient in areas of wintry-like weather where the sunlight is less bright and less time is available with sun. We know it becomes deficient with the nutritional issues. We know it becomes deficient with the if the GIT has a problem with absorption of vitamin D. We know it becomes deficient when there is some infection or something going on which is using the vitamin D very commonly. So there are many reasons for vitamin D to be deficient. So we know all of that. So now I should share my screen as well. So one quick second. Very good. So Jim, you're correct. So there are some comments about the ultraviolet B rays and then the area of the desert and others. So correct. So back here, we know that vitamin D is very commonly deficient in people. Then we also know that it is a risk factor for COVID-19. So lower levels of vitamin D can actually end up or cause the person to have more severe condition. Generally, vitamin D deficiency is defined as the levels lesser than 20 nanogram per milliliter. Vitamin D insufficiency is defined as the levels between 20 to 29. Normally, it is said that 30 nanogram per milliliter is a good number. However, the study that I had discussed with you, they thought that any number greater than 40 nanogram per milliliter was the right number to cause the COVID-19 symptoms to be less severe. I have been trying and advising people to have at least 60 nanogram per milliliter levels. Then we know advanced age, nursing homes, less sun exposure, wintry weather, incorrect sun angle. The sun has to be at 45 degrees or above, and we have to have ultraviolet B rays, then pigmented skin, and so on. So these are all the reasons for the vitamin D deficiency. We've talked about it many times before. So now let's look at this. There is an additional observation that air pollution is also associated with worst COVID-19 outcome. Air pollution. So if I go back to this study over here, if you see here, exposure to fine particulate air pollution. So if I increase this in size, exposure to fine particulate air pollution is also associated with worse outcomes for COVID-19. And then we'll continue talking about it. So that means here is a person, that person has low vitamin D levels, and he's also around pollution. That may be the cooking woods at home. So not cooking woods, but cooking using fire by woods at home, or the fireplaces at home that have wood being burnt for heating the homes, or that is the transportation related pollution, or that is industrial pollution, or that is cigarette smokes, or that is other kinds of pollution. That pollution actually causes vitamin D to become inactive. And when vitamin D is inactive, then the rest of the things become a problem as well. But the important thing is, it's not the vitamin D that itself becomes inactive. There is a function that vitamin D does. That function is inactivated. So we're going to talk about that mechanism. So the first thing to take away here is that not only the right vitamin D levels are necessary, second is it is also important to stay away from pollution. So let's say if you live in a place where you cannot help it, for example, you live in a big city, then try to use mask as much as you can. Similarly, if you use firewoods at home or fireplace at home, try to clean your chimney and make sure that less of the pollutants from that wood enter the home environment, and so on. So try to be as careful as possible. Now, I want to talk about the mechanism. What is the mechanism that causes pollutants to reduce the function or action of vitamin D? So let's talk about that. So number one, so here is vitamin D. We know that vitamin D can go into a cell. We have vitamin D receptors. These would take vitamin D to the nucleus, where vitamin D can go, and thousands and hundreds and thousands of genes, their expression is modulated. That means their expression is changed. So we are today concerned with a specific gene, one of the genes. That gene's name is HCAP18, HCAP18 gene. This gene, when it opens up, it produces cathelicidins. And I have done lots of discussions about cathelicidins and nuclear factor kappa B and other immunomodulators in the past in the context of vitamin D. So here just this much is enough, that when vitamin D is present inside a cell, the vitamin D receptor brings the vitamin D to the nucleus. Inside the nucleus, the genes are opened by the action of vitamin D, and one of those genes is HCAP18 that helps produce cathelicidin. Now, cathelicidin in turn is further cleaved. It is broken up into two pieces. The One piece, let's say, is inactive. The other piece is called LL73. This little tiny monster here is called LL73. That is the monster we are talking about today. Today is the story of a monster. So if you like these stories, please donate to the book project as well. I want to create a cute book with all of these drawings and still have rich medical knowledge in it, that when you are reading it, you are entertained as well. So that's my dream. That's my wish that I can do it. Let's see if we can. So here is cathelicidin. Cathelicidin is cleaved into two parts. One part is LL73. That LL73 arrives outside of the cell, and it has two interesting, important actions. One is this, look at this cute macrophage here. LL73 can actually connect with the toll-like receptors. Remember toll-like receptors, we've been talking about them for some time, that toll-like receptors are used by macrophages and other immune cells to bind with the pathogens and kind of ingest them and eat them up or phagocytose them. Connecting of a pathogen with the toll-like receptor also causes the second messenger mechanisms, or the mechanisms inside the cell, that cell becomes active and starts doing functions, immune functions. Right? So now what happens is LL73 can actually stimulate our macrophages, our good guys, our immune system, innate immune arm. They can stimulate the macrophage and poke them through the toll-like receptors to enhance their immune system behavior. So eventually the credit goes to vitamin D, correct? Because it was the vitamin D that came in and opened up the gene for cathelicidin, which allowed the LL73 to be formed. So this LL73 is now on behalf of vitamin D, helping our immune system to modulate itself. So that is one. Second, when LL73, look at this. I think this is a cute SARS-CoV-2 diagram. So this guy is SARS-CoV-2, and you can see he's all sad and he's crying, and he has a puncture in his membrane. So LL73, which is sitting here, when LL73 binds with the pathogens that have a wall or an envelope, that means bacteria or enveloped viruses. Not all viruses are enveloped. Not all viruses have a membrane on them. Some viruses have the membrane. Fortunately, SARS-CoV-2 or coronaviruses are enveloped viruses. Other are called, for your interest, other are called naked viruses. They do not have a membrane on them. So here, when the LL73 binds with the SARS-CoV-2, it causes a hole to be formed in the pathogen. If it's a bacteria, it would cause a hole in that bacteria. If it is a virus, which is enveloped virus, it must have a wall to make a hole in. Then the LL73 would create a puncture in the membrane or the envelope. Now, what is the benefit of creating that puncture? The benefit of creating that puncture is that once the membrane is broken, the material from inside the virus is going to leak out, as you can see here. So when that material has leaked out, the virus will become not viable anymore. It will become inactive. So this is how LL73 would inactivate enveloped viruses and other pathogens. Again, credit goes to vitamin D. Now let's see how pollution comes into play. What happens? So far we now understand that vitamin D is important. Then we also understand that vitamin D would help produce cathelicidins. Cathelicidins would in turn help produce LL73. LL73 will then go and cause SARS-CoV-2 and other pathogens that have wall or membrane or envelope on them to be killed. Good job on their part. Now check this out. This is once again an LL73. LL73 has an amino acid called arginine. So remember, all of these structures that are present in our body and organic structures, they are mostly made up of amino acids. Amino acids are like bricks, and these bricks have various kind of charges on them. Those charges act in a way to allow the bricks to either repel each other or to bind with each other. So the 3D structure and the function of these tiny microscopic machines is maintained because of the charges on them. So imagine if my arm, my shoulder, is connected to my body because the shoulder has a negative charge and the body area in the shoulder part has a positive charge, and you kind of snap them together. That is how all proteins and enzyme and functional structures are formed, by charges. So if for some reason you can disrupt the charge, for example, if my body side is positive and the arm's shoulder side is negative, and if you make them both the same charge, both positive or both negative, then you cannot snap them here together. And now the arm cannot connect with my body anymore, and I am disabled. That is what would happen. So there is, in this LL73, there is an amino acid called arginine. Arginine is positive, and that positive amino acid does its function for the LL73 to allow it to bind with the toll-like receptors and to bind with the pathogens. So this binding here that you're seeing, this binding needs specific positive, charges. Similarly, this stimulation of toll-like receptor also needs positive charges, or the charges on LL73. So if you disrupt the charges on this guy is not going to be able to work correctly. Similarly, if you disrupt this guy's charges, it's not going to be able to bind with SARS-CoV-2. The result is it's not going to work correctly. So here, check this out. So when the positive charge is present, and there are many positive and negative charges, we have an enzyme called peptidyl arginine deaminase, or deaminase. The function of this enzyme is to remove, if you see in this hand of his, he has the arginine with it. It is to remove the arginine from here and replace it with citrulline. Now, citrulline is another amino acid. Imagine another big brick type, but this is a neutral brick. So as soon as you put that neutral cartridge on the LL73, or neutral brick on LL73, all of a sudden, this little tiny monster which was helping us becomes a cute, tiny, loving thing. So it starts smiling immediately, and it develops a heart, and now it is all lovey and dovey, and it doesn't want to bite anything. So what happens now is the dust and pollutants, for example, wood fire or other type of fires, for example, to warm our homes, carbon nanoparticles that can come from transport or from industry as well, nickel nanoparticles, primary or secondary tobacco smoke, industrial or transport air pollutants, all of those have the capability of doing the same thing. They can citrullinate the LL73, or they can citrulinate the LL73. They can remove the arginine, which is here now, and they can add the citrulline. The result is that this little monster becomes all lovey-dovey now, and it doesn't do its function. The function was to go and bite a virus, or the function was to go and stimulate a macrophage or a neutrophil or whatever has toll-like receptors. Now this guy is in love. He has become all lovey-dovey. He's not going to do its function. The result of that is that pathogens are not killed effectively. The result of that is that the immune system is not activated effectively. That is the outcome. So that is the discussion for today. That means just having the right amount of vitamin D is not sufficient. We also have to have a clean environment around us, so that the vitamin D's after effect of combating a virus or a pathogen and modulating the immune system is correctly done by the vitamin D, and that can be disrupted by dust and nanoparticles. So that is the discussion for today. I hope you liked it. Please do me a favor. Please like, subscribe, and share. And I have, once again, I have these GoFundMe's. Please, on priority, let's collect some money for Nina for health insurance for her for the whole year. And then, if possible, for the book as well. So this is the discussion. And if you wanted to just donate to my work, there is a link in the description. You can do that too. So I'm going to look at some of the comments here and then we'll stop. So there's a question from Bruce Wapman. So Bruce, generally 30 nanogram per milliliter and above is supposed to be fine, up to 100. There was a study that showed that 40 nanogram per milliliter and above is more protective from COVID-19. I usually recommend 60 nanogram per milliliter. France says, excellent, Dr. Bean. I wonder if upping vitamin C and others can help combat. Absolutely, that would help as well. Kate says, I'll buy your book. Thank you, Kate. The problem is to first be able to write it. So hopefully we would together do that. So just to be clear, for writing the book, I need someone to transcribe the videos that we have done. I need an artist to redo these diagrams. And then I need somebody to do the grammar check and somebody to do the medical corrections. I have made some errors here and there as well. And then actual publishing. So there are 227 lectures now. So there's a lot of work, and hopefully we can do it. Bambi says, dust, I will watch it back once uploaded. I best get the polish and duster out. Good. Barbara says, I'll help edit the book, but I'm not a great artist. Don't worry. So I think what we'll do is this. If from the Cool Beans there are folks who can help edit, somebody else can help draw, somebody else can help compose, whoever, I hope that we can get enough funds to fund this project. Thank you very much. Shahida says, brilliant presentation. So can you please say something about famotidine, say any day? Shahida, I have done a complete lecture on famotidine. So if you go to my channel and just search for within the channel videos or within the COVID playlist video, if you just search for famotidine, you would find it. Josh says, I know words. I got you, Doc. I know words. I know good words, big words. Thank you. So there's a question from Rajesh. Question, left eye twitching after taking mega doses of vitamin D can indicate something. The calcium. So make sure that your calcium levels are correct with that. The twitching or the nervous systems, the tinkling, or those are actually calcium related. Vitamin D toxicity, it is really difficult to have vitamin D toxicity. People can actually, I have been giving to some of my patients 100,000 units or 200,000 units upfront and then leave them for a month or two and they're fine. When you go out in sun, for example, on a beach, and you stay there for 30 minutes or so, you can make 20, 30,000 units in that process. So just don't take too crazy an amount, 5,000, 10,000 units with MK2 or K2 with magnesium, copper, and that should be fine with calcium. But of course, make sure that you talk with your doctor, you make sure that your calcium levels are correct, make sure you do not have cardiac issues, make sure you do not have nervous system issues. So this is just me advising for an educational purpose that this is what should be done. Now, for a specific person, you should talk with your doctor and then discuss. Siddhartha says, maybe create a Trello board. Yes, Siddhartha, I think we'll have to do that and actually need a project manager as well who can do this. Bell Sativa says, my doctor prescribed vitamin D2 excuse me, 50,000 international unit. Then D3, I have parathyroid hormone with. So he is doing a very specific treatment, and that is fine. Jonathan Loon says, Dr. Bean, surely your illustrations go into the book. Yes, so what will happen is that they will get my art that I have drawn, and then as part of my teaching, I usually mess up the art, so they'll have to redo some parts of it and kind of make them a little bit better. James, we have been missing you for a long time. I didn't see you. I was actually going to reach out to you. So good to see you here. Levoarginine is the same as Argentine naming protocol. So should we talk about it? And that's a good question. So maybe we discuss it tomorrow, James. But good to see you here. E-Dog says, can dust carry COVID? E-Dog, very good question. So ideally, dry dust, should cause COVID inactivation by drying it out. So if the COVID is on dust, I'm not talking about floor or fine polished surfaces, but dust would actually cause the membrane of the virus to be damaged and the water to be pulled out of it. So ideally, dust can inactivate the virus. On the other hand, dust can allow the particles to be formed and suspended for a longer period of time, which may help with the transmission. Very good question. Al says, thank you very much. You're most welcome. So I guess that is the discussion. There is a question here. I just saw a question. Very good to know. So I was missing you. I was actually going to reach out to you today or tomorrow. So there is a comment. Diversity Love says, your hair is so perfectly gray. Is it? You must have had it colored, work of art. I do not get it colored. Perfect. Perfect. So I think that this is where we are for today. Please do me a favor. Please like, subscribe, and share. If you wanted to support my work, there is a donation link in the description. And I have created a couple of GoFundMe as well. My preference will be that we collect funds for Nina first. $2,400 for the whole year is not a lot of money. And I think one of the cool beans has already pledged $600. We have raised another 100 or so. I will put in my money as well. So if you can pledge as well, that would be great. Thank you very much. And I would see you tomorrow.